Hello everyone, welcome to another video. This video will be over elbow articular cartilage injuries. My name is Bailey and I will be walking you through this. So first, for the anatomy, we have the bones that make up the elbow joint, which are the humerus, radius, and ulna. And then the three ligaments that make up the elbow are the ulnar collateral ligament, also known as the UCL, the radial collateral ligament, also known as the RCL, and then the annular ligament, which runs across the forearm and the radial head. And then the types of cartilage, we have the capitulum and the trochlea. So for the three types of injuries that I'll be covering in this PowerPoint, there'll be osteochondritis dissecans, any loose bodies of cartilage in the elbow joint, and then osteoarthritis. So the pathology for osteochondritis dissecans is inflammation of the cartilage in the elbow, impairment of blood supply to the anterior surface resulting in degeneration of the articular cartilage, which can cause the creation of loose bodies. Repetitive microtrauma and movements of elbow rotation, extension, and a valgus stress leads to the compression of the radial head and shearing of the radial capitellar joint. Seen in young athletes, mostly involved in a throwing motion, and yes. So mechanism of injury for osteochondritis dissecans, commonly from overuse injuries in any athletes that use their dominant hand a lot, like baseball or hockey. Also, athletes who perform overhead activities like baseball or gymnastics, or both. The stages of osteochondritis dissecans. Stage 1, thickening of cartilage and a stable lesion is formed. Stage 2, articular cartilage interrupted and a stable lesion, low signal rim behind a fragment showing that there is fibrous attachment. Stage 3, articular cartilage interrupted, unstable, high changes behind the fragment, underlying subchondral bone. Stage 4 is a loose body and is unstable. So some signs and symptoms of osteochondritis dissecans would be sudden pain and locking, range of motion returns in a few days, swelling, pain in the radiohumeral joint, crepitus, decreased range of motion with full extension, and like a grady feeling with pronation and supination. So some special tests. There really aren't any special tests for osteochondritis dissecans. Basically, what a special test would be a range of motion test for pain, like a resistive range of motion, or also passive or active. And then imaging tests are usually required to get a good view: X-ray, MRI, CT, or a radiograph. Some predisposing factors. Age is most common in age is a big one. It's most common in young athletes between ages of 12 and 14, and athletes in overhead activities like baseball or gymnastics. Some differential diagnosis for osteochondritis dissecans would be Panner's disease in young children 9 to 10 years old, insertional apophysitis in prepubescent patients, rheumatoid arthritis, osteoarthritis, bone cysts, septic arthritis, and epicondylar avulsion fractures in older patients. So management and treatment would be removed from play for 6 to 12 weeks. Take some NSAIDs, non-steroidal anti-inflammatory drugs. Splint and cast can be applied for cases with extensive deterioration. If repeated locking occurs, loose bodies are removed by surgery. Locking can cause loose bodies. So referral, immobilization, refer to the doctor for possible surgery. There can be a brace put on the patient or splint for limited range of motion. Some prevention, strengthening and stretching exercises for the elbow, and limiting overhead throwing activities, like overuse. No Mulligan techniques are present for osteochondritis dissecans. So now to move on to loose bodies in the elbow. The pathology behind this is they are small fragments of cartilage that break off and float around in the joint space, usually formed as a result of another problem like osteoarthritis or osteochondritis dissecans. They can also be formed after an elbow fracture, or a dislocation can also cause a loose body in the elbow. Also by participation in certain sports or other activities that put tremendous stress on the elbow joint, like heavy manual work or weightlifting. So some mechanisms of injury for loose bodies in the elbow can form from osteoarthritis, elbow fractures, bleeding in the elbow joint, inflammation of trauma in the bone or cartilage, dislocations of the elbow. Some signs and symptoms of loose bodies in the elbow would be locking, clicking, crepitus, pain, stiffness, and decrease of range of motion. Special tests. There really are no special tests except for a range of motion test, a test for locking, pain, or stiffness, really. That also goes along with like osteochondritis dissecans. Basically, just do in a resistive range of motion, passive and active. Just do all three of them. And yeah. Some predisposing factors. Athletes involved in high contact sports, older patients that have a history of falling a lot, athletes involved in overhead throwing activities like baseball. Some loose bodies, some differential diagnosis about loose bodies in the elbow could be osteochondral fractures or osteochondritis dissecans, pigmented villonodular synovitis. There we go. PVNS basically. Osteoarthritis or severe degenerative disease, intra-articular fracture fragments, synovial osteochondromatosis. Some treatment methods. Surgery is most common. Some patients can live with loose bodies without pain, though, as a possibility. Basically take NSAIDs also, and therapy performed in and out of the clinic with a PT. Out of the clinic, obviously, without a PT. Refer to a doctor for imaging, basically impossible surgery. There really aren't any types of immobilization except for you could just say limit range of motion, like don't move that arm as much, or don't move it in the way that it locks or clicks or hurts. So some prevention would just be some strengthening and stretching exercises for the elbow, basically to prevent any tearing. Prevent any tearing of like muscles or cartilage in there. And other stuff you can't prevent, like you can't prevent a high contact sport and getting in a car accident. So No Mulligan Techniques are available now for loose bodies in the elbow. So now to move on to osteoarthritis. The pathology behind it is it's a degeneration of cartilage over aging and can happen from a previous fracture or bad sprain to the elbow. Some mechanisms of injury could be dislocation or a fracture, a capsular contracture, which is a drying up of the synovial fluid in the elbow joint, can cause osteoarthritis. Some signs and symptoms would be pain, stiffness, crepitus, decreased range of motion, a little bit of swelling, decreased strength though, and I'm pretty sure there will be a decrease of sensation possibly. Some special tests. There aren't really special tests. Just testing range of motion and strength would be the best possible test for diagnosing an osteoarthritis condition. Some predisposing factors, though, are older patients that have participated in active overhead throwing sports over the years. Athletes have had a lot of trauma to the elbow also, so like a lot of elbow fractures or have dislocated their elbow a lot. Some differential diagnosis for osteoarthritis would be a ligament sprain or tear, lateral epicondyle tendinopathy, medial epicondyle tendinopathy, ulnar neuropathy, undiagnosed fracture, referred pain from a cervical spine. So what that means is basically they could think it's more to do with your brachial plexus than it is osteoarthritis in your elbow joint. So they're going to look more at your spine than osteoarthritis. But a lot of pictures, yeah. So here, non-surgical, NSAIDs, injections, physical therapy. A lot of them will probably be surgical though, with arthroscopic debridgement, interposition, arthroplasty, an elbow fusion, or a complete elbow joint replacement. Refer to a doctor for imaging and possible surgery. Imaging is probably the best way to diagnose osteoarthritis, to see that joint space through like an MRI or an X-ray. That's probably the greatest test to do. Immobilization after post-surgery or after the surgery, and then prevention, strengthening and stretching exercises. Avoid any type of overuse of the elbow, and any type of traumatic injuries to the elbow will also help prevent osteoarthritis. There is no Mulligan technique for osteoarthritis. So for my Picot, it was about Osteochondritis dissecans for the elbow, which was a long-term follow-up study. I'll let you guys read this here for a little bit. There was only one patient, or 31 patients, not one patient. Alrighty. So my analysis, 31 patients over osteochondritis dissecans formation. The control group, basically patients with osteochondritis dissecans symptoms and patients without osteochondritis dissecans symptoms. It's split to 50-50. 50% had osteochondritis dissecans and the other 50 had no symptoms. And the time span was over 23 years. And here are my references. And thank you for watching. Hit the like button, and I hope you guys liked it. and have a good day.